Hello, I'm Dr. Hilary Kunins, Director of Behavioral Health Services and Mental Health SF. I'm here to speak about this month's overdose deaths. Last month, people died of an accidental overdose, according to preliminary findings released today by the Office of the Chief Medical Examiner. As in past recent months, the majority of these deaths were caused by fentanyl. This number is lower than in May 2023, when 73 people died of accidental overdose. We are seeing a downward trend in the second quarter of this year. Opioid-involved deaths, including from fentanyl, are preventable through highly effective treatments and other life-saving tactics. We want to be sure that the public knows that highly effective and life-saving medications are available in San Francisco to treat people with addiction to fentanyl and other opioids. At DPH, our priority is to increase the accessibility of substance use treatment services so that more people can enter treatment and regain their lives and health. Treatment is available at our primary care clinics, specialty behavioral health clinics, in permanent supportive housing sites, in shelters and navigation sites, and through our street-based services. Last month, we shared with you information about an exciting pilot program in which we are connecting people who are unhoused in the evening with telehealth visits. We are connecting them with an addiction medicine provider and a safe and supportive place to start treatment. From March through May, we conducted approximately 440 in the field nighttime telehealth visits for people who use fentanyl and other opioids. This month, we want to share how many of those people starting medication treatment are doing so through an innovative microdosing method developed at DPH. Microdosing makes it easier for people with opioid use disorder to start buprenorphine. As you know, buprenorphine is one of the two most highly effective medications and reduces the risk of overdose death by approximately 50%. I want to now welcome to the podium Dr. Joanna Eveland to share how buprenorphine is helping people start and stay in treatment. Dr. Eveland.
Thank you, Dr. Kunins. I'm Joanna Eveland, and I'm a Chief Medical Officer for a section of DPH focused on care for people experiencing homelessness and people who use drugs. I have also had the pleasure of overseeing the pilot program connecting people who use drugs in the Tenderloin at night with the opportunity to enter recovery in that moment. And we strive to get people ready for substance use treatment options because every individual's recovery journey is unique. For many people, medication for opioid use disorder is a great option to help them achieve long-term stability and meet their goals. A newer option to start medication is buprenorphine microdosing. Buprenorphine, like methadone, is a highly effective medication to treat addiction to fentanyl, heroin, and other opioids. While there are strict regulations around who can prescribe methadone, buprenorphine can be prescribed by any medical provider during a regular office visit. One of the greatest hurdles to recovery are the intense cravings and withdrawal symptoms that occur when somebody physically dependent on opioids stops using them suddenly. Withdrawal can be extremely painful as opioid levels in the body decrease. We know buprenorphine is a highly effective medication for controlling cravings. My patients who are taking buprenorphine report that they feel normal and stable. They can go back to work, they can take care of their families. The challenge with buprenorphine is first getting started on the medication. If you start too early while you still have another strong opioid in your system, like fentanyl, you can actually experience withdrawal symptoms. Microdosing, or gradual dose increases, provides a gentler way to start the medication. By starting with a small dose of buprenorphine and gradually increasing the dosage over days, we're able to mitigate the withdrawal symptoms. You can think of this like gradually turning the sound up on your stereo rather than cranking up the volume all at once. This innovative method for starting buprenorphine, which has been championed by our DPH doctors and pharmacists, has been published in medical journals, which we're making available to you here today. And in practice, we're finding microdosing popular with people who are entering treatment for fentanyl use disorder, including the unhoused people who are being outreached in the Tenderloin through our night treatment pilot. Microdosing is a great option. It's not the only option. And at the Department of Public Health, we believe there is no one correct path for recovery from substance use disorder. We encourage anyone who wants to stop using drugs or alcohol to reach out to their doctor or visit staff at our Behavioral Health Access Center at 1380 Howard Street to be connected to treatment. People can also call our 24/7 Behavioral Health Access line at 888-246-3333. And it doesn't matter if it's your first time or your 10th time seeking treatment. Recovery is possible, and DPH has programs and staff to help you along your journey. Thank you so much.